Mary Herne, I'm one of the nurse practitioners here at the Regis Mohawk Health Clinic. Just coming to you today just to talk about Lyme disease. Uh, Especially with the uprise of COVID, everybody's going to be going outside. So, just want you to be aware that, ticks are out and about. Usually once the weather starts getting above freezing is when they start coming out. So, even a couple of weeks ago there, it was still, they were just starting to get active. On average, 476,000 Americans are diagnosed with Lyme disease annually. And it's carried by black-legged ticks, otherwise known as deer ticks. So these little critters, they don't fly, but they do, get carried around by different animals. They can ride around on leaves. So Lyme disease is endemic to the Northeast, along with the Mid-Atlantic and North Central United States. So, of course, it's very common here. Anybody who's lived in this area already knows that it's very common. And basically they can latch on to any part of your body. Most often, most people who are likely to get it are people who can't find them right away, especially if they land on places that you can't see. They are often found in areas where you're not able to see them easily. So especially the groin, armpits, and your scalp are common areas where they can stay attached to without you really realizing it. In most cases, for Lyme disease to be contracted, they need to be attached for anywhere from 36 to 48 hours before, it's actually transmitted. If there have been you went hiking this afternoon and you ended up finding a tick on you later this evening, the chances of you having it are very low. Typically when they've had a full feed, they'll show up. They get pretty engorged. They, turn like a white color. Common signs and symptoms are, like a flu-like illness, like fever, fatigue. You get the body chills, the aches, whether it's muscle aches, joint aches. You can get swollen lymph nodes. We often, associate a bullseye rash with, Lyme disease. However, it doesn't, show up in all cases. So, you can still get a Lyme rash, but it's not always that characteristic bullseye rash. So Lyme rash might just be this, you get the red area there with still the redness inside the rash. And it can often get mistaken for, just a spider bite, just maybe you had a reaction to something, those types of things, can be mistaken and it can go untreated. But even then, there's still people out there who don't even get a rash. So, and they get those flu-like illnesses and it kind of gets chucked off to something else. Wearing bug repellent will help. When you are returning from outdoors, check your clothing to make sure you're not finding anything. Check your pets routinely to see if they have any ticks. Ticks are easily found in grassy, bushy, wooded areas. So, spending time outside, camping, gardening, hunting, those are all activities that can, put you at a high risk. Now, you can treat your clothing with any products that contain permethrin 0.5%. And these are, come in a spray form. So you can find them over at Walmart, Amazon has them, any of the camping companies might have them as well. These products can be used on your boots, clothing, camping gear. And basically what you would end up doing is just, spraying down these pieces, these articles, allowing them at least 2 hours to dry. If it's very humid out and you're doing it, then give it at least 4 hours. And even after you wash them, that product should still be on it for, I want to say anywhere from at least 2 to 3 washes. So especially if you're treating your hunting clothes, you might be good for a couple of washes. And that should help before you have to do it again. And then, whenever you're engaging activities such as hiking, you really want to stay out of, stay to the middle of the trail. That will help decrease your chances of getting a tick on you. for those homeowners who live at the edge of like heavily wooded areas, what CDC is recommending is that you set up like a 3 foot wide barrier on those edges there where the forest would start. This kind of helps like give a little bit of a buffer area, to lessen ticks coming in from that direction. You want to mow your lawn frequently and then also prevent leaf buildup in your yard because they can, like I said, mentioned earlier, they can ride on leaves and, carry it in that way. So if you do find a tick on you, you want to get a pair of tweezers and as best as you can, get as close to the skin as possible before like grasping them and, pulling up. You want to pull directly up. You don't want to do like a wiggle. You don't want to like twist them or anything, just because if you do something like that, it, increases the chances of the head getting stuck inside. And we really don't want that. If you do get the tick off and there's still a piece of the head stuck there, your body will, push the head out. It will take care of that. I know it's a little bit distressing that you didn't get it all out, but just do your best to kind of keep the area clean, keep an eye on it, keep an eye on your symptoms as we addressed earlier for any like blue light symptoms, for any rashes that might develop. Um, you know, Here at the clinic, we're able to test people for Lyme disease. However, we don't offer the services to like test the tick itself for Lyme disease. Now, as far as for treatment for Lyme disease, if you do have something that you are concerned. So for people who have found a tick on them and you believe it's been more than 36 hours and you got it off, but it's been less than 3 days, we are able to give you, a prophylactic treatment of doxycycline. If there's any concerns, just give a call and we can, set you up an appointment. For people who, get diagnosed with Lyme disease and are having mild symptoms, then we would get them started on, 2 to 3 weeks worth of doxycycline. If you're allergic to that, we can also treat with like amoxicillin. However, if you are somebody who are developing more severe symptoms, definitely head to the hospital. Sometimes people will need IV antibiotics in those cases. So, but usually, most of the times we're able to catch it pretty early. All right, everybody. I think that's all that I have for you today. If you have any questions, give us a call here at the clinic, 518-358-3141. Everyone have a good day. All right. Onagiwahe.